Let's talk health. It is World Hepatitis Day, and spotlight is on raising awareness about the global burden of viral hepatitis and to influence real change. Globally, 354 million persons are currently living with the hepatitis B or C virus. Hepatitis is a viral infection known as a major cause of liver disease, which leads to death if not promptly and properly managed. The World Health Organization says approximately 296 million people were affected in 2019, and 1.5 million new infections are recorded each year.
Millions of people around the world have undiagnosed and untreated hepatitis. Too often, the disease goes undetected until symptoms become serious. We now have better tools than ever to prevent, diagnose, and treat hepatitis. Around the world, WHO is supporting countries to expand the use of those tools to eliminate hepatitis and save lives. We're committed to working with all countries and all partners to realize our shared vision of eliminating viral hepatitis by 2030. Because we have one life, one liver.
One life, one liver. Let's bring in pharmacist and vaccine consultant for Emza Pharmaceuticals, Jacob Ogbaji, who joins us from Abuja via Zoom to discuss this. Thank you for joining us on The World Now. It's World Hepatitis Day. Talk to us about the burden of hepatitis in Nigeria. Just how serious is it?
Okay, thank you very much for having me. For Nigeria, the burden is even more serious than what we have globally. The fact that we don't have structured means of recording, the data we have make it difficult to give an exact value for the burden of hepatitis in Nigeria. But suffice it to say, from what we see, the burden is much higher in Nigeria, being a resource-limited area compared to what we have in the rest of the world. I would say the burden is much, much higher.
And we know that in 2020, the Minister of Health then, that was Dr. Sagi Hanire, mentioned that about 20 million people were at that time chronically infected with the hepatitis B and C. But you are a vaccine consultant. Talk to us about the role of vaccination in eliminating hepatitis, because the goal is, 2030.
Yes. Now, in alignment with the Immunization Agenda 2030, the plan is to reduce new infections by about 90% and to prevent death for about, reduce it to about 65%. Now, vaccines play a key role in preventing the infection with the virus, because as we know, there is no known cure for the infection. And now, once you take the vaccine, it ensures that the patient stays without, the infection. Now, there are 3 doses of the vaccine. To ensure complete protection, it's important that people take the 3 doses of the vaccine. And once that is taken, you show the liver is protected, the functions, the complications surrounding, the infection with the virus are completely taken away. So vaccines play a key role in preventing hepatitis infection.
But what category of persons can take the hepatitis vaccine?
Okay, the range is such that newborn babies, adolescents, healthcare workers, even aged parents that are prone to live in areas where it's well endemic, and pregnant women. I must say, these are categories of people that should take the vaccine seriously, the vaccine message seriously, and take the vaccine.
All right, but then how readily and easily accessible and affordable is the vaccine?
Okay, well, even though the vaccine is part of the NPI, the National Program on Immunization, but it's only free for children below 5 years. But outside that, it's available in, I must say, in pharmacies, in hospitals, where immunization programs are run. And it's not like some years back where it was difficult to get it. For us as a manufacturing organizations, we are tasked with that responsibility of making those vaccines available. So everywhere across the country, you can get the vaccines. They're affordable, such that you can complete the 3 doses in within 6 months for less than 6,000. So that's what I would say is quite available and affordable.
All right, then. Pharmacist, vaccine consultant with Emzo Pharmaceuticals, Jacob Ogbaji. It's been a pleasure talking to you. Thank you for talking to us on The World Now.
My pleasure. Thank you for having me.